Ever since the infancy of this process or this procedure itself, we've tried to make it very seamless and easy for not only the patients, but also for referring providers. And that is even on the day of the procedure. So a patient would come in for the procedure where they'll go to get ready for that procedure, be prepped. They'll see a very familiar face, which is our valve coordinator, so they can ask questions, they feel more comfortable. And then they're moved to a room that is very much like a catheterization suite that they're already used to. We utilize here in our anesthesia team to not only make the patient sleepy and comfortable, but also provide a very safe environment for the patient and us for this procedure. By the time they wake up, the valve has been implanted. All they have is a small Band-Aid on their wrist, 2 little spots on their groin, and by that evening we have them walking. The next morning we do an echocardiogram just to look at the valve, have them walk again, and start evaluating when this patient can go home and start recovering at home. So very seamless process, whereas an open heart procedure was a very tough process, not only after the procedure, but a recovery time period.
So before we offer this procedure here, every one of these patients had to go to either Birmingham or Atlanta to UAB or Emory to have this procedure done. Nobody really wants to leave home when you're sick. You already have a health problem. You're sick, you're not feeling well, you can barely walk, you're having problems breathing. And then you have to go out of town, stay at a hotel somewhere, navigate a system that you're totally unfamiliar with, have somebody help you through that process. We looked at the data and there's a significant amount of patients within this area that we were referring out to have that procedure done. And so to be able to offer that here, I mean, this is an up-to-date, high-tech procedure that we're offering here at East Alabama Health. And you don't have to go to the university to have that done anymore. We can do it right here at home. Most of the time when they come to us before the procedure, they've been saying things like, I can't make it to the mailbox without having shortness of breath. I can't make it in my own house without having to take breaks with shortness of breath. I used to could play golf and now I can't make it past the first 2 or 3 holes anymore. Those patients, as soon as they come back 1 or 2 weeks after the procedure, they can notice a big difference and usually are already asking when they can go back and do the things that they couldn't do before.
This helps people that are older, that can't tolerate having the surgery. They can still be treated for their aortic stenosis. If they're not treated for their aortic stenosis, then they're gonna eventually die from heart failure. So they created TAVR.
When you have to open the chest and close it, even though you close it, the bone still takes 6 weeks to heal. So there's at least a 6-week or more recovery period after open valve replacement. With the transcatheter TAVR approach, most patients are out of the hospital within 48 hours. And they're back home doing their normal activities within a week.
People that we think will have a tough time recovering overall, makes for a great alternative to an open chest procedure for them. The recovery is much faster, we get them back going, therefore their life resumes very quickly after the procedure as if before the valve became an issue.
It's been around for about a decade in the cardiac surgery and cardiology community, but a lot of people still don't know about it because it's a very specialized procedure.
These people are really the sickest of the sick patients. You know, they have heart failure, they have coronary artery disease, some of them already have pacemakers, they have chronic kidney disease, they have diabetes, they have high cholesterol, all of those things. And I started working in the CVICU as a nurse in 2000, so that's been a long time ago. Again, watching people have surgery and then have to be here for 5 to 7 days and then again kind of limp out of here, and then now we do this same procedure, same type of procedure but in a different type of way, and they really do go home the next day and they really do feel better. And then I see them at a week, I see them at a month, I see them at 6 months, I see them at a year, and it's just been really a joy as a nurse to watch these people, again, older, frail, who might not have had the option to prolong their life with a quality, get this opportunity and they feel better. It's just been really fun to watch.
I would like to thank not only the patients that we've done, but also future patients, the referring providers, and the community for not only allowing us to grow a great program now, but to flourish in the future.